Okay, welcome to the 2026 Benefits and Insurance Open Enrollment. My name is Julie Siptar. I'm here at the District Center, and I'm joined by Maddie Boos from Health Partners and Jen Cross from Gallagher Benefits. So tonight we're going to go through our health plan renewal, and we're excited to be offering a new option for medical insurance. We'll talk about changes to dental insurance. We'll be talking about Kavira. We're going to be continuing that program for another year. It's been really popular. Life insurance through standard insurance, our MedSurety plans, both the VIBA and the flex spending. So with that, I'll turn it over to Maddie.
Yes, well, good evening, everyone. Thank you so much for having me. Happy Teacher Appreciation Week to those teachers on the call and just everyone on this call working in the district. You do such a wonderful job being in the education world to begin with. So thank you for being here and excited to talk about insurance on a Monday night. So kicking us off, you guys will be remaining with us for your Health Partners medical insurance. There are a few changes for 2026 that are coming out. One of the changes is just for non-emergency services rendered outside of the United States territories is no longer not covered. If you are outside and an emergency happens, please note there is still coverage while you are traveling. Again, it's just for non-emergency services. You are also offering a new select network. We call it our select network that I will be diving a little deeper into over these next couple of slides. We also have a new discount vendor through LifeMart is our partnership with them. And so I will talk about a little bit about that later on in the presentation. And then also to the copay plan, you will see if you are on that currently, there is some slight increases to the out-of-pocket accumulations. And Julie, and Jen, it's kind of seeing that it's not passing on my view. Does it look like it changed over from your side?
Nope, not from yours. Let me try again.
There we go. Thanks, Jen.
Thank you.
All right. So with that, we're just going to do a quick high-level overview of your medical plan benefits. The copay plan is closed to new enrollment, so you'd only be eligible for that plan if you are currently enrolled in it today. The deductible plan is open to all eligible employees. And I'm going to walk through some key terms to help you understand how plans are administered. So you'll see the deductible is the amount you are responsible before insurance kicks in, with the exception of any preventive care and copays. And then the out-of-pocket maximum is your kind of total risk for being on the plan, thinking of as long as you incur eligible expenses, you'll never pay more than that dollar amount in the planned year. So know also that $3,000 per member is capped. So if you are on a family plan, you won't put any more than $3,000 towards your family plan, as it is an embedded medical plan. When you are in network, that preventive care is covered at 100%. So I will talk about preventive visits later on as well. And on the deductible plan, you are subject to the $1,500 deductible first, and then covered by the coinsurance after that. You also have coverage for hospital visits. Your pharmacy prescriptions are copays. And then also on the plan is out-of-network benefits. So that when you're considered out-of-network, that means that plan does not have a contract with that provider on the plan. You can still go out-of-network if you wish. However, your expenses will be considered much higher. And one thing I would point out too when it comes to this is on the select network, we really want to remain in network. And so that is one of the reasons too, you'll see that the amounts for going out of network are much higher on the plan. So the first network that you can choose from is our open access network. This network is available again on both the deductible plan and the copay plan. This is the network that has been with the Roseville Schools for the past several years now. If you want to search for providers, you would go to healthpartners.com/open access. This includes all the major care systems within Minnesota. If you're needing to see Health Partners Park Nicollet, but Alina, Fairview, if you're wanting to go to Mayo, these providers are all considered in network for the open access plan. This also includes access coast to coast wherever you are. So if you do have dependents that are away at college or living out of the state, they still can receive in-network care on the open access plan. It's kind of shifting for me again, Jen. There we go.
Still frozen, Maddie.
A little frozen shift.
Let me refresh quick.
And thank you all for your patience. We did practice this before, but you just never know when things are going to happen, even after our practice. So the Select Network is our more defined network that we are offering on the deductible plan only. So this is for the deductible plan only. Again, it's more defined because it really focuses in on our health partners and Park Nicollet care providers only. So if you are already a patient of Health Partners and Park Nicollet, this would be a great option for you to switch over to this defined network. You'll see that the cost difference is a lot lower, and that is because it is more of a limited network. So it mainly consists again of Health Partners Park Nicollet alongside Children's and a few other specialty care providers as well. It does not include, I should really emphasize this, it does not include Alina or Fairview or Mayo. So if these providers are important to you, this would not be the network choice for you. You can search the website again, similar to how you search for open access, but this time you go to healthpartners.com/select, and it's the same search engine, but it would get you to this network. And I'm going to dive in on the next slide even more on the Select network. So here's a quick overview too of like a picture. If you're thinking of the metro area, the Select network does have a lot of our Health Partners and Park Nicollet providers within the area that we mainly live. The other note too, you do have access outside of the Twin Cities too. However, if you have a dependent that is in Iowa or the surrounding states, so North Dakota, South Dakota, Wisconsin, those providers are considered out of network. So we really are focusing on bringing the care back into the Twin Cities, back into our care network. So you only have access out of Minnesota when you get outside of our 5-state region. So if you have a dependent still available or still going to college out in California or down in Florida, and they are outside of that region, they'll find in-network care. But if they are going to college in the surrounding states, they really do need to come back into the Twin Cities for their care. And as we were going through and working with Gallagher and your benefits team, looking at where do you, as possibly a member, currently go? This is the top providers that we found within the Roseville School District, a few that were just listed on the screen that are the top providers where we're seeing people go. And then noticing, is it in the Select network or if it's not? So if you see one of your top providers that you go to and it says no, then this would not be a good network for you. If you see your providers on the screen, it says yes, this would also help you make a decision to switch over. And as mentioned earlier, if you are currently going to a Health Partners in Park Nicollet and seeing our family of care providers for your primary care or other specialties, this would be a good network choice for you. They also, within the Select network, also focuses in on mental health care and chiropractic care needs too, just so we can expand our providers a little outside of those two. When you're looking at healthpartners.com/select, if there is a particular specialty that you're looking for, you can search by searching the "to help me with" and type in the specialty that you're looking for, and then also typing in the zip code. And if your provider pulls up while you're searching, then this would mean that it is in the Select network for you. Please also note that if you do want help searching the providers online or are questioning if your provider is in or out and trying to decide which network is the best for you, our member service is aware that you are adding this network. So if you call our member services, that we are also happy to help search the networks for you and provide that assistance. And one thing too we want to highlight is trying to stay on top of our care before something becomes too serious. We know that staying on top of our care, going in for preventive checkups can help us maintain as best we can. So knowing what you're due for, you can go to healthpartners.com/preventive. You can type in your age and gender, and it will kind of give you a list of ideas of possibly things that you are due for. And preventive exams are covered at 100% when you are in network, when you're seeing your provider. One of the other things we want to highlight, we know that your time is valuable and also limited sometimes depending on your position and the school hours. And so knowing that you do have some virtual care options, the three that we tend to promote here at Health Partners are up on the screen: Virtuwell, Doctor on Demand, and Teledoc. Each offer virtual care options. Some are a little different than others. Rather, if you want to fill out a survey, if you want to actually meet face-to-face, or want to have the option to do both, each of these providers kind of gives you that flexibility. Please note that Virtuwell is only offered in the Open Access and Select network. So the Doctor on Demand and Teledoc are only for the Open Access network only. Okay. Now moving on to the pharmacy. Pharmacy is always a big topic in my world, and it is ever changing with new medications coming onto the market on a daily, it seems. Please note our formulary, we are always monitoring the medications that can be best to you, that are low cost to you, but also effective at the same time. You can search our coverage at healthpartners.com/preferredRx. It will also give you a key too to note if your prescription is a specialty pharmacy medication, if you need a prior authorization. It will help you identify what are the criteria for your prior authorization. Please note, I know another buzzword in my world right now is always asking about weight loss medications. And this weight loss medications are still excluded on the plan. So they are not covered for the foreseeable future. It is something that we are still monitoring at Health Partners and other carriers too, and keeping a close eye on it in the market. Some of the tips and tricks I say to get the most of your medications is to try to stick to generics. Those will be your lowest cost to you. You can also search for the lowest costs within our Health Partners website. We also have our pharmacy navigators available to help answer any questions. They are an extended branch of our member services, and they are there to help answer questions. If you have any questions over prior authorization, run into any issues at the pharmacy, please note, or if you're looking for a different medication and need assistance, they are there to talk pharmacy. You can also meet with a pharmacist. The link is on the site here at healthpartners.com/mtminfo. They are also a pharmacist if you're wanting to talk with somebody, if you're taking multiple different medications from a few different doctors and want to make sure that they're working correctly for you, or if you're finding something that maybe is no longer working and would like another suggestion, just know that that is also a part of your plan, is to be able to meet with the pharmacist. Another option that we have within our pharmacy benefits is that we do have a mail order pharmacy program. So if you are wanting to get your medications delivered right to your door, we do partner with HealthDyne to get them delivered. You can set up that account right through your Health Partners online account, and then those medications will get shipped, delivered right to your door discreetly, so no one knows, like, here comes your medications, but you can track your package just like a normal delivery as well. All right, and now we're going to switch over to the dental plan. So this is the first official welcome to Health Partners Dental. You will be making the changeover effective 7/1 of 2026, so in a couple of months here. The overview on the dental plan is on the screen here. Please note that dental is kind of unique in that it works opposite of medical. So the calendar year annual max is the most that the plan would pay per year. And there are different levels to your plan design too. So you have benefit level 1 in network, benefit level 2 in network with us, and then an out of network benefit. Please note that the deductibles and annual maximums reset annually on January 1st. So we will be getting, Jen and I will work together to make sure that we get all of your accumulations so far on file during the transition. We normally wait until a little bit after July 1st to get that first file over to us. So please be patient as we make this transition, and note that we will try to get your annual maximums on file with us, along with the lifetime ortho maximums on file with us too. So with Health Partners Dental Plan, you'll be on our Dental Tiered A network. So similar to our Health Partners Open Access and Select links, this is our dental link down at the bottom of the screen at healthpartners.com/dental tiered A. This is how you'll want to search for the providers. You'll be able to type in your zip code, and then on the screen, it will tell you if your provider is in benefit tier 1 or benefit tier 2. If it does not appear on that search, then that is considered an out-of-network dentist. So knowing the dental tiered 1, again, will give you your best benefit with your dental insurance. On your dental plan, you still have preventive dental care screenings. I'll talk about our HealthWise MouthWise Matters program in a little bit, and know that you can refer to the summary as well for reference for the benefits. So note, one of the exciting things to me is you guys do have access to Health Partners Dental Group is now going to be part of the plan too. So if you'd like to make a one-stop shop, but you do not have to go there. You do not have to go there, but that is one big change, is that the Health Partners Dental Group is now an option for you to go to if you wish. We also looked over at all of the dental claims that came through on Roseville's plan to help make sure Gallagher and the district knew some changes. So we do have most of the providers are still in network with this. Your dental premium costs will remain the same. If you currently are in dental coverage, that's going to be transferred over unless you make a change during open enrollment. You will get a new ID card for dental as well. And so you'll want to start using that July 1st of 2026. Please note that you will get one ID card for medical and one ID card for dental now if you take both the medical and dental insurance. Your ID number is the same. So if you are already holding a Health Partners medical plan card, you already know your dental ID number as well too. So that will also help with the transition if you have an appointment in the first week or two of needing care. Also with our Health Partners insurance is a program called MouthWise Matters. This is for those who are diabetic or are pregnant. And this is something where you will have extra cleanings and checkups. I know that when I was pregnant, my gums were swelling up and I didn't realize it was because that could be a symptom of pregnancy. So staying on top of our dental care is just as important as our overall body health as well with medical. So this is a program that we offer to those, again, who are pregnant or living with diabetes. To get started, you can go to healthpartners.com/mouthwise matters to get enrolled. Now, just to add on some extra support for having Health Partners Insurance. I know, again, thank you for being a Health Partners member with us so far. If you don't already have an online account, this is my slide to encourage you to do so. You can go to online to healthpartners.com to create one. And on our website, you'll be able to make connections about the slides I'm going to talk about in the future, but also it holds where all your explanation of benefits are and how and where you can search for your providers and other resources online. I also wanted to highlight some resiliency tools too. So we do have a mental health hub. We also have programs like My Strength if you're looking for resources to help with any resilience or mental health. We also have behavioral health navigators. They are part of our member services as well. And our behavioral health navigators are there to answer any network or benefit questions when it comes to mental or chemical health. And one thing I wanted to highlight within your Health Partners programs and perks area is WellBeats. WellBeats is an on-demand fitness classes if you're looking to do workouts at home. WellBeats also offers food and planning. So if you're looking for nutrition ideas or a meal plan for dinners this week, WellBeats is a program that we have available to members for free that you can use to access those goals. Another program I want to highlight is the My Rewards program. This is a newer program that recently started within Health Partners within the last year. This is something where you can create and complete some certain activities and actually get paid to do them. You would get an incentive to do them on a reusable MasterCard that gets refilled that you can use as you please. I would look for that little trophy icon or go underneath programs and perks and you'll search for My Rewards to get started. Also within your plan is access to Omada. Omada is a program that helps with prediabetes, diabetes, and hypertension. It's available to all qualified members who are over the age of 18. You do have to qualify for this program and meet their criteria, but what you'll work with them and they'll guide you with a health coach, interactive weekly lessons, and they will provide all the tools and resources to work through their program. If you are interested in seeing if you are eligible for Omada, you would go to omadahealth.com/healthpartnersomada. A few other resources we have are support programs we offer. The first one on top is for those living with a chronic condition such as diabetes, asthma, heart disease. We do have access to nurses. If you're looking to speak with a nurse about your condition or wanting next steps of looking into resources or helping coordinate care, you can go to healthpartners.com/nurse support. We also have a pregnancy program. So if you are pregnant or expecting and want to have an additional assistance, talk with a nurse, when you have questions in the middle of the night randomly and want to get connected with somebody, you can be a part of our pregnancy program as well. To join, you can go to healthpartners.com/healthypregnancy. We also have a back pain program. So for tools and resources, we know that a back pain and living with back pain is not fun. And we also know that surgery is on the other end of the spectrum and is really hard to take time off work and go that route. So we have tips and resources of what we can try before we get to that point. If you'd like to learn more about our back pain program, you can go to healthpartners.com/backhealth. We also have a cancer management program as well. So for those that are facing a cancer diagnosis, just know that we do have additional support if you'd like to get connected with additional resources to support you through the journey, or if you are a cancer survivor, we can get started at healthpartners.com/cancer support to get you connected with our nursing and staff. We also have a partnership with Pivot. This is a program for those who are thinking or wanting to make a choice and no longer smoking, and it's smoking, vaping, or chewing. And this Pivot program will give you the resources to quit that habit if this is a change that you're wanting to make. This is offered for free as part of your health plan. And one of the resources I wanted to highlight, when you log into your member portal, underneath your My Plan and Programs and Perks section, you will see different discounts available. You'll also see discounts for Active and Fit Direct. So on the right-hand side, the Active and Fit is our gym discount membership. So this is a flat fee you would pay per month. So if you go to one of those gyms listed on the screen, or I know that sometimes the community centers are also in network within the Active and Fit Direct, then this is something that you would want to look into to switching over to save some dollars. You do not have to go X amount of times per month or anything like that. It's, again, just a flat dollar. Please note that the Lifetime Fitness is not in this at direct gym discount. And it really is just limited to the LA Fitnesses, Snaps, Planet Fitness of the Worlds, and some community centers and Wise and things like that. On the left-hand side too, again, we partnered with LifeMart. They offer a variety of discounts just for having Health Partners insurance. To get to LifeMart though and get the discounts, you will want to log in again through your Health Partners online account. This is for your medical and dental insurance. Regardless if you take one or the other, you'd still have access to it. One of the highlights I do also want to talk about is the hearing aids. We do offer the hearing aids discounts through True Hearing. I know that that was one of the questions that was brought up with your other dental carrier, or your current dental carrier, I should say. So I do want to highlight that you still have access to hearing aid discounts through True Hearing. You also have access to Assist America. So if you are traveling outside at 100 miles and you lose your luggage, need help with translation, this is a provider that you have access to help with any travel needs. All right, so this is for those of you that are new to the plan. This is what your Health Partners ID card would look like. Again, your Health Partners and medical and dental ID number will remain the same. So the difference that you'll see is just if it's going to be your medical versus a dental card. The group number also remains the same with Roseville. So you'll still have the same group number, same member ID. So you can start making appointments as needed for anything after July 1st. And just know our member services phone number is on the back of the ID card. And then lastly, this is my last slide for you. If you do have any questions, please know our member services available, ready to answer questions Monday through Friday, 7 to 6. Again, we have pharmacy navigators available, behavioral health navigators available. Our nurse navigators are there as trained nurses to help answer any more complex medical questions. We also have access to a Caroline service, which is a nurse line for 24/7 nurse line if you're needing the assistance, or a baby phone line as well. Please also note too, you can always send our plan a message as well through your online account too, if you'd rather not call in too. So thank you so much for your time. I'm going to pass it to Jen now to continue on.
Thank you, Maddie, and apologize that my screen isn't proceeding the way that I'd like it to be. Maddie, if you don't mind, if I could task you if you could like put a hand up or something if the slide doesn't move forward when I would like it to. So I'll just be very clear audibly of what we're looking at, and hopefully you're seeing the same things. So first, wanted to highlight the Kavira benefit that we will continue to offer to all employees who are enrolled in the district medical plan. So for those who are participating in medical insurance, you as well as your immediate family members will have access to Kavira for another plan year, so July through June. And through Kavira, you're able to receive no cost care for a variety of services that I'll highlight on the next slide. But these are going to be treated either through chat, through a video call, as well as the opportunity of having an in-person house call. So having a nurse practitioner through Kavira come to your home and treat you for a condition that is on a rise. In addition to those visits, they are able to fill up to 300 various medications. Over 30 labs are able to be drawn. And all of this care is available for you to receive, again, at no cost to you. So a really great first stop for some of those mundane conditions. But I will add that it's not required that you use Kavira. It is an added benefit that you are able to utilize in the need of that care. So here, I hope that I'm showing a full list of services that are available for care through Kavira. So a range from acute conditions such as cold sores, insomnia, pink eye, strep throat, things along those lines, all the way to chronic conditions such as acne, mild anxiety and depression, asthma, hair loss, as well as hypertension, obesity. All of those are chronic conditions that you can connect with Kavira to receive care through in lieu of going through the Health Partners insurance and having your deductible and out-of-pocket maximum responsible as well. From a preventive care perspective, you can have wellness exams as well as sports physicals. So if you have any kids that are participating in school sports and need to have that annual physical, you're able to have Kavira come to your home and have them complete that sports physical exam as well. For imaging, you're able to have non-emergency x-rays and EKGs completed through Kavira. And then again, as I mentioned, up to 30 free labs as well as 300 medications are able to be filled through Kavira. So moving forward on our HRA Viva, which is administered through MedSurity. The HRA Viva is tied to our deductible medical plan. So now we offer 2 deductible medical plans starting July 1st. One is paired with the Open Access Network and the other is paired with the Select Network. In either instance, if you're enrolled in that deductible plan, it is tied to an HRA Viva. And an HRA Viva is a spending account that is district funded. So if you enroll in that medical plan, the district will automatically put dollars aside into your own personal HRA Viva, and you're able to spend those dollars on medical, dental, and vision expenses that you or your dependents incur throughout the year, and use those HRA Viva dollars to offset your out-of-pocket cost. The district's contributions to your HRA Viva will vary depending on your employment group or union contract. A few other highlights on the HRA Viva is the dollars are available for you to spend once they are funded to your account. So you'll get a portion of your annual contribution throughout the year per pay period. And as those dollars hit your account, you're able to spend it on the healthcare expenses that you and your dependents incur. If you don't spend your full contribution in the plan year, don't worry about that because your money will carry over from year to year. So if you only, you have a low cost year, you don't have any out-of-pocket healthcare costs, you don't spend any of your HRA Viva dollars, all of those dollars will be available for you to spend the next year and the year after that. So you don't have to worry about losing the dollars. If you're also participating in a flexible spending account, a quick note is that our flex plan is always going to pay first before we touch your HRA Viva dollars. And the reason for that is if you have participated in a flexible spending account in the past, you may know that that account is use it or lose it. So you want to make sure that you spend down your flexible spending dollars before we touch your HRA Vivas because your flex is use it or lose it. Those dollars do not carry over, whereas our HRA Viva, we can build that balance up over multiple years and still have those dollars in our name for a future date. Eligible expenses for the HRA Viva are defined as the IRS code 213D, which are going to be medical, dental, and vision expenses. So now I'm going to talk about the healthcare flexible spending account, which is also administered by MedSurity. Hopefully my screen aligns with what I'm speaking to. The flexible spending account is pretty different from the HRA Viva. First being that this account is fully funded by you as the employee. If you want to participate in the healthcare flexible spending account, the full elected contributions will be withheld from your personal paycheck on a pre-tax basis and moved into this healthcare FSA account that you'll be able to spend on medical, dental, and vision expenses that you incur throughout the year on a pre-tax basis as well. The IRS does set maximum elections each year, so the most you're able to put into an FSA on a pre-tax basis. And for upcoming plan year, that maximum election is $3,400. So you're able to elect up to that amount for our 2026-2027 plan year, running from July to June. However, while that's the most you're able to contribute, just keep in mind that this account is use it or lose it. So you only want to elect during open enrollment time what you know you will incur and spend between July 1st of 2026 through June 30th of 2027. If you have dollars left over at the end of the year, the most you would be able to carry over to the following plan year of 2027 will be $680. So you're allowed a little bit of buffer, but really keep in mind this account is use it or lose it, and we really want to plan for what expenses we expect in that time frame and make that FSA election accordingly. With the healthcare FSA, your entire election will be available for spending on the first day of the plan year. So during open enrollment time, maybe you're getting glasses and you want to get it on July 2nd. So you're going to elect $500 for the plan year with the intent of spending those dollars on your new pair of glasses. On July 2nd, that day, you'll have that full $500 election that you're able to spend on that eligible expense. Throughout the year then, as you have your payroll deductions, a portion of that $500 will be withheld from each paycheck throughout the year to fund back that contribution that you made for the plan year during open enrollment time. I want to make a quick note on the HSA, and while we do not offer an HSA medical plan at Roseville Area Schools, this may impact you if you have a spouse who is covered under care elsewhere and their medical plan is paired with an HSA. Now, the IRS has some pretty tight rules around health savings accounts or HSAs, and one of those being you cannot contribute to an HSA if you also have access to a healthcare flexible spending account. So, what this means for you is if you have a spouse who is making or receiving contributions to an HSA through their employer, you will want to avoid the healthcare FSA at Roseville Area Schools because your participation in the healthcare FSA would disqualify your spouse from making and receiving contributions to an HSA for that corresponding plan year. Our healthcare flexible spending account runs from July 1st of 2026 through June 30th of 2027. So again, we're thinking of what expenses will incur in that time frame and choosing our election based on that anticipation. In addition to the healthcare FSA with MedSurity, we also offer the dependent care flexible spending account. So the dependent care FSA has nothing to do with medical insurance or the doctor and is all about child and elder care expenses. And these are expenses to allow you and a spouse to go to work. This account is also funded with your pre-tax dollars. So the election you make during open enrollment time will be funded from your paycheck on a pre-tax basis. And the maximum amount you're able to elect for our upcoming plan year is $7,500 per family. So this is a unique rule to dependent care FSA where this maximum is per household per year. So if you have a spouse who also has access to a dependent care FSA through their employer, you'll want to connect with them and confirm what their contribution is for the year. So when you make your election during open enrollment time, between the two of you, you do not exceed this annual maximum. The dependent care FSA is going to be available for spending as your account is funded throughout the year. So you make your election during open enrollment time, and that first payroll deduction might only contribute $50 into your dependent care for that first period of the year. That means you'd only have $50 for reimbursement at that time. There's two ways that you could reimburse yourself from your dependent care FSA. You could either submit claims for reimbursement for a balance that exceeds your current funded amount. And as your dollars go into your dependent care FSA, you could automatically receive those incremental contributions based on the claim that you submit for your dependent or elder care expenses. Or you could wait until the end of the plan year when you have that full election amount funded to your account and then being reimbursed that full dollar amount at once. There's no right or wrong way. It's your preference on how you'd like to ultimately be reimbursed with your pre-tax dependent care FSA dollars throughout the year. This plan year also runs from July to June, but this account does not have any carryover like the medical FSA does. So this is truly use it or lose it. You only want to contribute what you know you can spend in that plan year for those eligible dependent care expenses. When participating in the HRA VIBA or medical flexible spending account, you will receive a debit card from MedSurity, which will give you instant access to pay for claims that you are incurring throughout the year. This debit card acts as any other traditional debit card where there is an expiration date on it. So if you've been participating in this account for a few years, it's always good to take a quick look at your expiration date, see when that's approaching, and if it's coming up soon, keep an eye on the mail because they'll automatically send you an updated card and you don't want to accidentally throw it away. So just take a look to see if your card's expiring soon, and if so, keep a watchful eye in the mail for an updated debit card for your use. If you have an HRA Viva as well as a health flexible spending account, you will have a single debit card that you're able to access both accounts from. If you remember me speaking earlier about the flex paying first, that'll also apply to our debit card. So you have a flexible spending account as well as an HRA Viva account. If you use your debit card, it is automatically going to pull dollars from your flexible spending account first. Since that's use it or lose it, we want to spend down those dollars before we touch our HRA Viva dollars, which can accumulate and roll over year after year. So the debit card will automatically act on your behalf of pulling dollars from your FSA before your HRA Viva. If your account dollars are getting low, keep in mind that you must have the full balance in your account whenever you're using a debit card. So if you have a $100 expense, but only $50 left in your account, and you try to swipe your card, it's going to be denied. You still have access to those $50 left in your account. You're just going to have to manually reimburse yourself through the portal. So in that instance, you would use a personal payment method and then submit that paperwork online through Maturity, in which you'd then be reimbursed that last $50. With these pre-tax spending accounts, the IRS has some pretty strict rules around documentation so that they can be sure everyone using these pre-tax dollars on healthcare expenses are actually being spent on pre-tax dollars and not a vacation or a new wardrobe. So MedSurity is often going to be requesting documentation when you are accessing your flexible spending account or HRA Viva dollars to confirm to the IRS that the dollars are being spent on eligible healthcare expenses. So this is called substantiation and can be satisfied by providing a detailed receipt or an explanation of benefits in which you're able to verify my $100 expense was for an eligible, medical procedure with my doctor. And with that documentation, the dollar amounts aligned, it's an eligible expense, it will be approved. So with that, whenever you're spending your FSA or HRA Viva dollars, it's very important that you keep a copy of your detailed receipts or EOBs. So if that's requested of you further down the line, you have all the documentation required in order to have that purchase be approved. The two best methods to satisfy that documentation requirement is, again, through an explanation of benefit, which is going to list the name of the individual who incurred the expense, the details on the provider that you received that service through, the date that the service was charged, as well as a description of the service that you actually received. So if you're using your payment for a expense that is incurred in a facility, a doctor visit or such, you are able to use that EOB. Or if you're purchasing something like Band-Aids or Tylenol from Walgreens, you're not going to have an EOB. You are able to use a detailed receipt that lists clearly what the item was and the cost associated with it, so that, again, MedSurity is able to verify the expense that you made was for that eligible expense. So a few reminders with the flexible spending account. Our plan year for our FSAs are going to be July of 2026 through June of 2027. So that's the window of time that you're able to incur and spend the expenses that you are that you elected for the plan year. We do allow about a 2-month submission period in which, if you don't get all of your receipts and claims submitted to MedSurety by June 30th, we'll allow until August 31st to submit all that documentation to MedSurety for processing. But again, it can only be for claims that were incurred in those 12 months of plan years. Both the medical FSA and dependent care FSA requires an annual election each year. So our medical insurance and dental insurance will carry over for you year after year if you don't make any active changes during open enrollment time. We're not able to do that for our 2 FSA accounts. So if you want to participate in a flexible spending account for the upcoming plan year, you'll have to actively make that election on MedSurety's website so that you have those dollars ready on July 1st for use. I'll say it again that these dollars are use it or lose it, so you really want to think ahead of what you expect to spend between July to June. Unfortunately, you're not able to change your FSA elections mid-year unless you have a family status change. To make these open enrollment elections with MedSurety, you'll do so through their website. If you are already a member with MedSurety and have a login, you will log in as usual and make your open enrollment election through your portal page. If you have not participated in the HRA Viva or FSA in the past and you need to create an account for the first time to make your election, you would do so through the right-hand box that says Open Enrollment Access. We also have an annual voluntary life insurance election opportunity that is limited to open enrollment time. So if you are currently enrolled in voluntary life insurance of $10,000 and would like to increase your election to $25,000 or $50,000, you are able to do so during our open enrollment window without having to provide evidence of insurability or any type of medical documentation of good health. So this is a unique annual opportunity. Again, you will not have to provide that evidence of insurability in that period if you're following those regulations. If you are enrolling in voluntary life insurance for the first time, or you've elected it in the past and had to provide evidence of insurability and that was denied, you will then have to satisfy the EOI requirement. It's an online form that you'll fill out, and your elected coverage will not be active until that EOI is submitted to the standard, who's our administrator, as well as approved by them. A quick reminder that we do still have our employee assistance program through the standard, which is administered by Health Advocate. This is a free resource to all district employees and is really the number that you call when you don't know who to call. So if you're looking to be connected with someone for short-term counseling, legal connection, financial advice, if you're looking for childcare providers and you just don't know who to reach out to find a creditable resource for you, that's what the EAP is there for you to do. They'll do the research, they'll hear what you're looking for, find a few options and refer you to them so that you're not spending your time trying to find a good legal contact. They're able to give you a few options and connect with them that way. This benefit's available 24/7, is completely confidential. So anything you reach out to the health advocate for support on is between you and the representative. That's never communicated back to the district or to Gallagher. So you can rest assured that those conversations are confidential. And you also get 3 face-to-face visits per issue per year. So if you are looking for some short-term counseling and want to connect with someone face-to-face, you do have the opportunity to have up to 3 of those visits on that topic of mind. So open enrollment is our annual opportunity to make any benefit election that we'd like without having to have a kind of a reason or a qualifying event to justify the need that we have. Outside of open enrollment time, you're really locked into those elections with the exception of if you had a qualifying life event. So if you enroll during open enrollment time for yourself as a single individual, and then in October you get married, that would be a qualifying event that you'd be able to add your new spouse to the district plan. So these are a few examples of qualifying life events that would allow a mid-year change to our benefit elections. But it's very important to keep in mind that you only have 30 days from the date of that event to make that change with the district. And that's a timeline set by our carriers and is very strictly enforced. So if you have a qualifying event coming up or that occurs quickly and you need to make changes to your elections, please reach out to your benefits team as quickly as possible so that they can make sure that changes are made for you and your family based on the event that occurred. So lastly, what do you have to do? For open enrollment this year, our benefits outside of flexible spending accounts are running on a passive enrollment year. So if you are happy with your current medical coverage and dental coverage, and you don't want to make any changes for the upcoming plan year, it'll automatically carry over to the following contract year without your active action. If you would like to participate in a flexible spending account for July 1st, 2026 through June 30th of 2027, you will have to make those elections actively online through MedSurety's website. And all of these open enrollment windows will be closing on Friday, May 29th. So you have the entire month to review the benefit details, ask your questions, and get those elections submitted by Friday. And then the coverage will be effective July 1st of 2026. I'd like to apologize again for the technology issue, but if there's any questions, we'd be happy to take them at this time. Or Julie, if you have any additional remarks, please go ahead.
I haven't got any questions in the chat box, but if anybody has any questions, please reach out to me. All this information will be on the district's website. We already have the plan summaries. We already have the costs listed. So log on to the district's webpage. Under services, click on human resources. You'll see links on the left side of the screen. Click on employee benefits. And then there's different sections for each insurance plan. And like I said, the costs are also listed. Okay, there's a few questions coming in. The price difference between open access and the select plan, that will be on the district's webpage. It's all broken down by your employee groups. Everyone pays a little bit different depending on the plan. So check that there. Someone said, what is the preferred method to submit the plan changes? Paper form. So in that announcement that went out yesterday and through communications, there's a link to a change form. So if you're wanting to change plans, medical plans, I should say, or change coverage from single to family or the other way, fill out the form, send it to me over at the district center. If you want to email it to me, that's fine. But if you're adding dependents, we do require a social security number. So you may want to just put the paper form through district mail and I'll get it the next day. If you're questioning what plan you're already enrolled in, I can just reach out to you directly about that.
Yeah, and I can add for the medical plan right now, you are all if you're enrolled in medical right now, you are all enrolled in our open access network. So that would answer the network question. Or if you look at the back of your ID card to know for the medical plan, if you're on the deductible plan, you'll see the coinsurance amounts on the back of your card. And if you're on the copay plan, you'll see copay amounts on the back of your card.
Great. Thanks, Maddie. And thank you, Jen. I appreciate it. We will put this presentation together and have it available to you hopefully tomorrow or the next day. But all the other information is out on the website. So thank you for joining us. Thank you, Maddie and Jen. This was really valuable information for our members here, so we appreciate it.
Thank you, everyone, for joining us.
Yes,
Okay,
thank you.
bye-bye.
Have a good day. Bye.